Welcome, and thank you for providing us with the opportunity to present our 2020 Allwell Medicare Advantage plans. You are joined today by a local Allwell representative who is a licensed and appointed insurance sales professional and does not represent Medicare or the federal or state government. Today we'll cover the basics of Medicare, as well as our Allwell Medicare Advantage plans and what to expect as a new Allwell member. Your local Allwell representative will also provide you with specific information about the Allwell Medicare Advantage plans available in your area. Since we will be covering a lot of information in today's meeting, we have provided you with an optional permission to call card. By completing this card, your local representative can contact you to assist with any questions after this presentation. Allwell seeks to improve the quality of care for our Medicare beneficiaries by offering Medicare Advantage plans with the right benefits and access to quality providers. Our plans feature access to our network of providers, a comprehensive formulary that covers frequently utilized prescription drugs, and coverage for additional benefits. All of this leads to value and security in your health plan choice. Allwell is contracted with Medicare to provide Medicare Advantage plans and prescription drug coverage benefits in your community. In select states, we are also contracted with the state Medicaid program. We offer several types of Medicare Advantage plans, including Preferred Provider Organization, PPO plans, and Health Maintenance Organization, HMO plans, and Special Needs plans, SNP. Some plan types may not be available in all areas. Later in our presentation, your local representative will discuss which types of Allwell Medicare Advantage plans are available in your area. Let's get started with the basics of Medicare. The four parts of Medicare are Parts A, B, C, and D. Part A is hospital coverage and covers services such as inpatient hospital stays, skilled nursing facility stays, home health, and hospice care. Part B is medical coverage and covers outpatient services such as doctor visits, lab services, x-rays, emergency room care, outpatient surgery, and durable medical equipment. Together, Parts A and B make up what is called Original Medicare. Part C is Medicare Advantage plans. These plans must cover everything Original Medicare covers and often cover additional services. As a Medicare Advantage plan member, you are still a Medicare beneficiary, but you get all your covered health services through your Medicare Advantage plan. Part D is coverage for prescription drugs. Original Medicare does not include Part D coverage. It must be purchased through an insurance carrier, either as a standalone plan or as a part of a Medicare Advantage plan. Now that we have covered some Medicare basics, let's turn our attention to Allwell's Medicare Advantage plans. You are eligible to enroll in an Allwell Medicare Advantage plan offered in your area if you are entitled to Medicare Part A and enrolled in Medicare Part B, and continue to pay your Medicare Part B premium. If you are a U.S. citizen or lawfully present in the U.S., if you live in the plan's service area for at least 6 months per year, and if you do not have end-stage renal disease. Additional eligibility requirements may apply to special needs plans where available. If you are Medicare eligible, there are several important dates to remember. Each year, you have an annual election period that lasts from October 15 to December 7. During this time, you can add, drop, or change your Medicare Advantage or prescription drug plan, PDP, coverage. Any changes you make during this time will be effective on January 1 of the following year. Between January 1 and March 31, current Medicare Advantage plan members may also make a one-time change to a different Medicare Advantage plan or disenroll from Medicare Advantage and switch to Original Medicare. If you switch to Original Medicare, you may also add a PDP. This is called the Open Enrollment Period, or OEP, and changes are effective the first of the month following receipt of the completed enrollment application. Please note that the OEP election also applies to newly eligible Medicare beneficiaries who enroll in a Medicare Advantage plan. The OEP is available for 3 months, beginning the month the beneficiary becomes eligible for Medicare Parts A and B. Please take a moment to address any questions with the beneficiary. When you turn 65, you also have an initial enrollment period that lasts for 7 months, 3 months prior to your birth month, and 3 months after. During this time, you can join a Medicare Advantage plan or a prescription drug plan. Your effective date will depend on the month in which you submit your enrollment. Certain changes in circumstances may also provide you a special election period, or SEP, giving you the ability to add or change a Medicare Advantage plan or prescription drug plan. For example, you would have a special election period if you are eligible for a special needs plan, Medicaid, or extra help, if you move out of your current plan service area, or if you lose your group insurance. Eligibility dates for these special election periods vary, and enrollment rules are based on each specific SEP. Previously, we mentioned that Allwell offers several types of Medicare Advantage plans. Let's take a closer look at each of these plan types so that we can understand their similarities and differences. Health Maintenance Organization, HMO, and Preferred Provider Organization, PPO, plans must both include all Medicare A and B covered services, but there are important differences in how the plans work. HMO plans coordinate your care to assure your health coverage needs are met. You will choose a primary care provider, PCP, from the plan's network who will participate in this care coordination. You may need to get a referral from your PCP to see a specialist, and some covered services may require prior authorization or approval in advance. On an HMO plan, you will also need to use providers in the plan's network for your care, except in special circumstances like emergencies. If you choose to obtain routine care from out-of-network providers, you will be responsible for the costs. PPO plans allow members the flexibility to choose to receive covered services from providers either in or out of the plan's network. The difference is that it may cost more to go out of network for care. In most cases, you will not need a referral to see a specialist. Prior authorization is required for some in-network services and recommended, though not required, for out-of-network services. Please take a moment to address any questions with the beneficiary. There are also 3 types of special needs plans, or SNPs. Allwell also offers 2 different types of special needs plans, or SNPs. SNPs may not be available in all areas. Your local Allwell representative will discuss SNP availability and eligibility later in the presentation. All SNP plans are designed to provide focused and specialized health care for specific groups of people, and all include both medical and Part D prescription drug coverage. Chronic Special Needs Plans, or CSNPs, are designed for Medicare beneficiaries with specific severe or disabling chronic conditions. Dual-eligible special needs plans, or DSNPs, are designed specifically for people with both Medicare and Medicaid. Every Allwell plan includes access to our network of providers, hospitals, and other medical facilities. To find an in-network provider, you can use the plan's printed provider directory, visit the plan's website to use the online search tool, or call our member services team for assistance. For those members on an Allwell Medicare Advantage plan that includes Part D coverage, you also have a pharmacy network. You can choose to fill your prescriptions at any of the plan's network pharmacies and do not need to visit the same pharmacy each time you fill a prescription. Some plans may have a pharmacy network that includes both standard and preferred retail pharmacies. For these plans, members can fill prescriptions at either type of network pharmacy, but you will generally pay less when you use preferred retail pharmacies. Your local Allwell representative will discuss the pharmacy network for the plans available in your area. You can find network pharmacies listed in the pharmacy directory, online at the plan's website, or by calling member services. Allwell also offers network mail order pharmacy services for many frequently utilized prescription drugs. Our formulary identifies what prescription drugs are covered, as well as their coverage levels. Drugs are listed alphabetically in the index at the back of the document. After locating the page number of the drug in the index, turn to that page in the formulary for more information on the drug's coverage level and any requirements or limits. The Allwell formulary is available in print, online at the plan's website, or by calling our member services team. If you are a new plan member or existing member whose drug coverage has changed, you may also request a one-time 30-day supply of a non-formulary or restricted drug. This is called a transition fill. Members may also request exceptions, such as a tier exception, a waiver of restriction or limitation on your drug, or coverage of a non-formulary drug. You or your prescriber would contact the plan to request an exception. Please take a moment to discuss restrictions and abbreviations from the formulary preface. How does Part D work? Let's take a look. How much you pay for your medication depends on which of these 4 stages you are in at the time you get a prescription filled or refilled. Stage 1, if applicable, is the annual Part D deductible. If your plan has a Part D deductible, this is the amount you must pay for your prescriptions before your plan begins to pay its share of your covered drugs. Stage 2 is the initial coverage limit, or ICL. During this time, you pay your copays or coinsurance for covered drugs. Your plan covers the rest. In 2020, you will stay in this stage until your year-to-date total drug costs, which includes your payments plus the plan's payments, total $4,020. After that, you would move to Stage 3, the coverage gap. During this stage, you'll pay a percentage of the price for your prescriptions, plus a portion of the dispensing fee for brand-name drugs, until your total out-of-pocket costs reach $6,350 in 2020. If this occurs, you'll then move to Stage 4. If you reach Stage 4, the catastrophic coverage level, your share of the cost for a covered drug would be either 5% coinsurance or $3.60 for a generic drug and $8.95 for all other drugs, whichever is greater. The rest of the cost is paid by your plan. Please take a moment to address any questions with the beneficiary. Another important element of Part D is extra help, also called low-income subsidy. If you have limited income and resources, you may qualify for extra help to assist with paying for your Medicare Part D prescription drug premiums and costs. Those who qualify for extra help also are not subject to the coverage gap or late enrollment penalty. To find out if you qualify, you can contact your state Medicaid office, Medicare, or the Social Security Administration. Part D also has a late enrollment penalty. If you do not join a Medicare drug plan when you are first eligible, your monthly plan premium may be higher when you do enroll in Part D, unless you have other creditable prescription drug coverage, including coverage provided by a current or former employer or union, TRICARE, or the Department of Veterans Affairs. You may also incur a late enrollment penalty if you have a break in your creditable coverage of 63 days or more. The cost of the penalty depends on how long you went without Part D or creditable prescription drug coverage. Please take a moment to address any questions with the beneficiary. It is also important to understand how your health plan costs work. Let's discuss a few common terms that may apply to your Allwell Medicare Advantage plan. The first is plan premium. If applicable to your plan, the premium is the monthly payment you make to the health plan for coverage. Next is annual deductible. Some plans include a yearly medical and/or prescription drug deductible. A deductible is the amount you must pay for health care and/or prescriptions before your health plan begins to pay its share. When it comes to your cost sharing for plan-covered services, generally it is in the form of either a copayment or coinsurance. A copayment is a fixed dollar amount you pay when accessing covered services, while a coinsurance is a percentage amount you pay as your share of the cost. Your local plan representative has provided you with our 2020 Allwell Medicare Advantage Plan Enrollment Guide. This packet includes important information, such as our summary of benefits, with information on local plan choices and cost sharing, our Plan Star Rating Notice, which shows our overall Plan Star rating, a multi-language flyer, a non-discrimination notice, and our enrollment form. Your local representative will be discussing these documents in more detail in a few moments. As you complete your enrollment form, be sure to mark your plan selection and include important information about yourself, such as your full name, your residential address, your mailing address, if different than your residence, your Medicare claim number or Medicare beneficiary identifier, and the name of your primary care provider. Please remember to sign and date the form as well. If you prefer, you can also complete your enrollment form online at the plan's website or over the phone with a Medicare Advantage sales representative. Your local plan representative is also available to help you complete the enrollment form. Once your enrollment form is complete, you're on the path to becoming an Allwell Advantage plan member. As a new member, you'll receive important communications from us. We'll send you an enrollment confirmation letter to show that Medicare has approved your enrollment with Allwell and that you are covered by the plan. Next, you'll receive a post-enrollment packet of member materials, including an evidence of coverage and a notice of how to obtain plan directories. You will also receive your new Allwell Medicare Advantage Plan ID card. Be sure to use this card when accessing plan-covered services. Use the phone number on the card to contact your member services team with any questions you may have as an Allwell member. At the time of enrollment or shortly after, you will also be asked to complete a Health Risk Assessment Questionnaire, or HRA. The HRA will ask questions that will help your plan to learn about your specific health-related needs and concerns. Your answers will not affect your health insurance benefits, costs, or membership in any way. Completing the HRA allows your plan to work with you and your primary care provider to better meet your healthcare needs. Now your local Allwell representative will discuss the Allwell Medicare Advantage plans available in your area using your enrollment guide. Thank you for allowing us the opportunity to speak with you today about Allwell Medicare Advantage plans. We look forward to welcoming you to the Allwell family.